All right, once again, good morning, everybody, and welcome to today's ePACES for Doula webinar. My name's Neil Aaron. I'm one of the provider outreach trainers for GDIT eMedNY. We're the fiscal agent for New York State's Medicaid program. And this morning's session is a general overview of ePACES, the electronic provider assisted claim entry system for doulas. And this is also considered part two of a two-part series of doula billing. Part one was last week, I believe it was on Wednesday, and this is part two as the follow-up on how to submit your claims, as well as checking eligibility and a whole bunch of other good things we'll show you within ePACES. Today's session scheduled for, I think, an hour and a half, 2 hours, depending on the number of questions we have. We're probably going to be closer to that hour and a half, but we'll see how it goes this morning. I have several of my colleagues in the background as well as a couple of people from State Department of Health. Should questions come up, we'll try to do the best we can to answer them. We do ask that you hold your questions to the end. This way we can try to get through the presentation, get everything covered, and then we will answer your questions at the end. We'll have time to do that. If you do have questions, as you can see on your screen, all of your lines have been muted upon entry, but we do have a Q&A feature within Zoom on your Zoom toolbar. So if you do have a question, you can certainly put that in Q&A, and we will look to answer that towards the end of today's session. If you have a question, please keep in mind this is a public forum and we want you to ask your questions in a general nature. We don't want anything specific containing protected health information, PHI or PII, personally identifiable information. So we don't want any claim information, member information, your information. So we would just appreciate it if you would keep your questions general and to the topic at hand. If you do have additional questions or you need specific training, we do have our eMedNY call center, the 800-343-9000. You can certainly reach out to them after today's session if anything comes up that you have additional questions on, and they'll be more than happy to help you as well, and they can always set up training sessions with you. Now, if you do have a question, as I said, there is a toolbar that you should see on your screen. And on the toolbar, you'll either see a Q&A feature, or you might have to go to the little more button there, and then you'll have a little drop down, and then Q&A should show up. But again, you can type your questions in there. If you wanted to type them in ahead of time, that's fine. But like I said, we're not ignoring you. We're going to try to answer them as best as possible towards the end of the session, since a lot of times when questions get entered in early, we wind up answering them as we go along. All right. We also do have a survey, a brief poll at the end of the session that we might be releasing as well when we answer those questions for you. So before we actually get into the ePACES training directly, we like to always start with some resources for you and where to find some additional help, your policy information, your manuals. So this is the emedny.org website. Hopefully you're all familiar with it. You signed up for today's session there. And we're going to just show you a handful of things that you could find here that'll be helpful for you in general as doulas, as well as for ePACES. So if we look here in the provider manual section, the fourth tab over from the left, if you go to provider manuals, you'll see an alphabetical listing of provider manuals for all the different categories of service within New York State Medicaid. And you'll see down on the right bottom there, you'll see when you get to D, you'll have the doula provider manual. And it's really important that you go to the doula provider manual and you look up your policy guidelines, your billing guidelines. We do have also a link to videos. Here's actually a part one that I had mentioned earlier. This is from I guess it was probably the one a couple of months ago when we initially did it, and we'll more than likely be updating the information. There's also links to other training videos. And like I said, we will be posting this video once we're done with today's session. So be aware of your doula provider manual. And there's also in this top box a link to the State Department of Health's doula services benefit page too. So you can certainly, use this as your jump off point if you'd like, but you could certainly get to the State Department of Health's doula services page from here as well. All right, so a lot of important information here in the provider manual for you. A subset of your provider manual is the MEVS manual. MEVS stands for Medicaid Eligibility Verification System. And it's important as a provider that you understand the process of checking member eligibility too. This way, when you have cases come your way, you can check the eligibility of the member to see, does this member have any other insurance? Is it regular fee-for-service Medicaid? Coming up at the beginning of 2025, we'll have a conversation about managed care Medicaid covering the doula benefits. So we want you to be able to check eligibility of the members, and we'll discuss how to check eligibility in ePACES in a little bit. But this is the manual, the MEVS manual, that'll help you and give you information about checking member eligibility, including about the benefit card that you might see a member present to you, how to check eligibility if you wanted to do so over the telephone. There's an automated audio response unit, or ARU, that you could use, or you can check eligibility, like I said, in ePACES, which we're going to show you an example or two in a little while. We also have here the reference table. So when you do check the eligibility for the members, you'll be able to see, like in section 4.1, the different benefit descriptions that you can get back so you can better understand what that member's eligibility covers. We also have different types of rejection codes, decision codes, exception codes, different county codes. And if you're a New York City provider, we have the New York City offices listed for the Human Resources Administration. So a lot of information here about member eligibility verification. Way up on the top right where it says self-help above that Google search box, self-help has a whole bunch of different sections, but you'll notice when you go there on the top left, lots of bullets about ePACES. So this is where you can go to get ePACES specific help. Point out two different links here. The Claim Quick reference guides, if you were to click on that link, that'll bring you to 4 different claim guides. Your type of billing is professional. So doulas are going to be billing as professional claims. So if you wanted to print this out, if you haven't already done so, this is going to be the screenshots and field by field definitions of ePACES. Now, it's a general overview for any provider that uses professional type billing. It's not going to be specific to what you're going to be doing as doulas, but it's definitely a helpful document. It has the screenshots, and you can use that in conjunction with the descriptions that we're going to go through today, which are a little bit more specific towards what a doula would be entering on a claim. We also have ePACES reference sheets. Now, the reference sheets break down ePACES into smaller topics. It'll explain to you maybe how to check an eligibility in ePACES, how to void or replace a claim that maybe you submitted and got paid and they had to adjust something, how to edit claims. So there are lots of little self-help documents that you could use, and they're called reference sheets. And you could find them here to help you along with ePACES as well. Second tab over from the left is the information tab. And a lot of times we get questions about timely billing information. And if you go to the timely billing information section here, there are several documents regarding timely billing in New York State Medicaid. And we actually discussed this sort of at length when we did the part 1 training session last week with the State Department of Health. But here are some additional documents that you might want to look at if you have questions about timely billing. This FOD, Facts on Demand 7001, explains in submitting claims over 90 days from the date of service. And that's actually the sort of the cover letter document that you would include with paper claims if you were to submit a claim on paper, which is an option. And there's also the Guide to Timely Billing. And that's a slide deck from a presentation that the State Department of Health gave a little while back, a couple of years ago, but it goes through, if you're not familiar with the timely billing guidelines for New York State Medicaid, it goes through the guidelines. And then it explains to you the different delay reasons that are available to providers if you're submitting a claim over 90 days from the date of service. That's the general cutoff for a claim to be considered on time for New York State Medicaid. You have 90 days from the date of service. Anything over 90 days, up to technically 2 years from the date of service, you still could possibly submit for payment, but you have to have what we call a valid delay reason code on your claim. And I'll show you that field when we get to it in ePACES. But this document here, the Guide to Timely Billing, if you're not familiar with those rules and regulations for timely billing and the different codes that you could use, this document, the Guide to Timely Billing, would be the one that you'd want to refer back to. smack dab in the middle under provider outreach and training, we have our eMedNI training calendar. Right now we're towards the end of September, and then you can see today's session over here, the 23rd. We post our training sessions on a quarterly basis. So October, November, December, the last quarter of 2024, will be posted shortly. And you could sign up for other types of training. And we just don't have doula training as a Medicaid provider. You might want to sign up for other training sessions like we had last week. We had an eligibility, a MEVS session. You could sign up for something like that. We also have new provider, new biller sessions for any Medicaid provider that's new to Medicaid. You can always sign up for that type of training. We also have an eMedNI website review where I'm just giving you a couple of real quick highlights here, but we spend about an hour going through the entire eMedNI website and showing providers lots of helpful things that you might want to be using to help you go through Medicaid billing, policy, looking things up. So all that good stuff could be found here on the eMedNI website, and you can check out the training links. And we do have additional featured links where you can see training videos. If you go to the training video links there, that's where you'll find a lot of videos. And the State Department of Health has posted several doula-specific videos. Some of them are enrollment-based, how to enroll for doula services. And we are, as I said, going to be posting this session as well as that part 1 is already available out there. A couple of other things real quick here before we get into ePACES. The eMedNI listserv. One of the things as a Medicaid provider, you want to stay on top of any sort of changes that might be going on. And one of the ways that you can get sort of information on what's happening within Medicaid as a Medicaid provider would be to sign up for the eMedNI listserv, bottom right there. That'll bring you to a page like this. And then you could subscribe by clicking subscribe in this column for general Medicaid updates. You're going to be possibly using ePACES, right? That's why we're here today. So you'd want to subscribe to be notified for ePACES updates. And then as you scroll down under provider type, once you get to D for doula, you could check off subscribe to doula and just give us your email address twice, click You're Not a Robot, and click submit. And then you'll be added to our listserv. So anytime anything comes up that's important to any of those categories you've subscribed to, you would get a notification through email. There are also archives here. So if you missed any of the prior articles, you could certainly check out the archives. We also have the State Department of Health's Medicaid update articles, the bottom link on the right there. That'll bring you directly to the State Department of Health's Medicaid update. And similar to the eMedNI listserv, the state has their own monthly periodical, so to speak, that gets sent out electronically. You can see they're archived starting this current year, going back to 1999. You could search by different topics here by typing it in. And you could also sign up to be on their listserv, so you would get notified when the monthly State Department of Health Medicaid updates are released. And you can certainly do that through Medicaid Update at health.ny.gov. So those are some real quick resources for you to help you with Medicaid. And also don't forget you have the Department of Health's doula website as well that you've, I'm sure, been going to get a lot of information there for the doula resources page too. So now to ePACES. Again, ePACES is the electronic provider-assisted claim entry system. Doulas will be using what we call the professional version of ePACES. There's also institutional and dental, but you're going to be using professional. And the way you get into ePACES is through the emedni.org website, which we were just giving you that brief overview. And if you notice here on the right-hand side, you'll have login to ePACES. Now, ePACES requires a separate enrollment. So once you've enrolled in New York State Medicaid and you have your provider ID number, you're also going to have something called an ETIN, an electronic transmitter ID number, and a certification statement that you'll be filling out to get all of this done. You'll also have to enroll in ePACES if you do want to use ePACES to submit your claims electronically, check eligibility. And the way you would do that would be calling our 800-343-9000 number, the eMedNI call center. Give them your provider ID, your NPI number, and tell them that you're interested in enrolling in ePACES. There'll be a couple of emails back and forth, and then ultimately you'll wind up with a username as well as a password. And you'll check that you've read and agreed to the Medicaid confidentiality regulations listed above, right over here. And then you'll click Agree Login. Now, we have a couple of slides in the doula billing part 1 session that gives a little bit more detail into the step-by-step nature of what you have to do to enroll in ePACES. So if you attended last week's part 1, you heard about some of that. But if you didn't, you can always go back and catch the video from the part 1 building session for doulas, and it explains a little bit more about signing up for ePACES, the steps. But again, to initiate it, you're just going to simply call our 800 number at 343-9000. Once you've logged into ePACES, this is the welcome, the home screen for ePACES. You're going to have your provider name and your NPI up at the top left-hand corner there. So you're going to want to make sure that your name's up there correctly in your NPI. Then down the left-hand side, you're going to notice all of the functions or the features that are available to you in ePACES. Starting, oops, a little too quick there on the wheel, starting with the claims features up on the top left. So for today, we're going to show you how to enter a new claim from beginning to end. You can find claims that you previously entered in ePACES. Sometimes you might want to do that if you have to, maybe you submitted a claim and it denied and you want to go and edit the claim and resubmit that claim. You can go find that claim here. Once we show you how to enter a new claim this morning, we're going to show you how to go to real-time responses. So once you submit a claim, you're basically going to find out pretty much immediately, within a matter of a couple of seconds, the status of that claim, whether it paid, if it's denied, if it rejected or is pending. So that's one of the really good benefits of using ePACES. You can submit your claim electronically, and it's free of charge, by the way, for Medicaid providers, New York State Medicaid providers. You just have to enroll it. It is free of charge. So you'll submit your claims electronically and then get a response back in what we call real time. So you don't have to wait a couple of days, a couple of weeks to get paperwork back or a remittance statement back. You'll be able to get an immediate response to see how you did with that claim submission. The other options here, building claim batches and submitting batches, you're not going to have to worry about that because we're going to teach you how to submit your claim in professional real time, which means you don't have to worry about taking the extra steps of building your batch and submitting it. Those 2 extra steps, don't have to worry about that. Similarly, your status inquiry and response, like I said, we're going to have you check your status through the real-time responses. You theoretically could check claim status for claims that, maybe you submitted on paper, or some providers hire billing companies or clearinghouses to submit their claims on their behalf. So you can always check the status here for claims like that. But as I said, we're going to have you check your claim status by going to real-time responses after you submit your claim. The next set of features down would be your eligibility, request, and response. So this is where you're going to check member eligibility. I'm going to skip it and actually going to come back to that in a couple of minutes. I want to take you first through the entire list of the features, and then we'll come back and loop back around to how to check member eligibility. And we'll spend a couple of minutes on how you would check eligibility and give you a couple of examples of responses, and we'll do that shortly. The next set of features includes prior approval, PA, and DVS, the dispensing validation system. And for doula services, you're not going to have to really worry about prior approval or DVS. That's not required for your type of service. So you're not going to have to worry about using any of those features. Next down, we have the support files. And the support files, there are 3 of them, as you can see. The provider support file has referring providers, rendering providers, providers that sometimes are used on a claim. You're not going to have to really worry about adding different types of providers for referrals or things like that. Other provider types do. So this is just where those providers would have that information kept. Similarly, there's an other payer support file, and Medicaid is always the payer of last resort. So if there's any other insurance involved, Medicaid providers always have to go through the other payers first, and then if there's anything left, they would be billing Medicaid. Now, as far as doula services go, they're not really covered by too many other insurance companies or Medicare or other payers. So that's really not a support file you're going to have to worry about too much. But if the need arises or if something happens where there is other insurance, this is where you would put the other payer. You'd have to create a support file for them, giving us the other payer's name and the type of insurance that other payer is. And again, we'll have a screen a little later on that mentions other payer as well. So we'll discuss that again briefly. But right now, for doula services, probably not something you're going to have to worry about too much for the other payers. Then the submitter support file, that shows you your ETIN, your electronic transmitter identification number. It's either a 3 or a 4-digit number or combination letters and numbers, as well as the decertification date of that ETIN. And as I said briefly earlier, an ETIN is something that providers need to have on file in order to actively submit claims and work with Medicaid. And that was part of your enrollment, your initial enrollment with New York State Medicaid. You had to have signed a certification statement and applied for an ETIN. And this just shows you the ETIN that's on file and associated with your ePACES account, as well as when it decertifies. But we will typically send you out a letter notifying you when your ETIN will decertify, usually 45 days before it expires, and then another one 30 days prior if we haven't already heard from you. So this is just another good way to double check when that will decertify. So in this case, you're good till the end of December. So you're okay for the next, couple of months, but you'll probably be getting that notification that you're going to have to fill out that certification statement, get it notarized, and send it off to New York State Medicaid to continue to have an active ETIN on file. And then lastly, on the very bottom, we have the user admin features. And user admin or user administrator account, this plays in more for other types of providers where maybe there's like a large doctor's office or a clinic or a hospital where there are going to be multiple users within the ePACES account. And the individual that typically gets the ePACES account up and running is identified as the user administrator of that account. Now, being that you're pretty much the person, you're providing your services as a doula, you're doing your billing, so you are the user admin more than likely, especially if you went and did the legwork, like I said, to get all of this up and running for ePACES and everything else. But let's say maybe you had somebody, that was doing the billing for you, or you were a larger company and had several people going into ePACES. You don't want to be sharing one username and one password for everybody to use. It's not really a good safety, security, privacy technique to do it that way. So the user admin can actually go in and add other users to your ePACES account. This way, all of the different users on the account will have their own login credentials instead of sharing one, which again, not the best way to do things. So this link here is just for the user administrator to go in and add users, or they can also edit users that have already been added to the account. Again, something you're probably not going to have to worry too much about using. You're primarily going to be looking at the claims features, and if you wanted to check eligibility, you'd be using the eligibility features through ePACES. So that's the general functionality going down that left-hand column there. So let's go back here now to eligibility. Now, it's really important to check member eligibility ahead of time. And this is true across the board for all Medicaid providers, because there's really no way of you knowing just by looking at a member's benefit card whether that member has valid eligibility, if they're covered for Medicaid, and if they are, what's possibly going on behind the scenes that you don't know about. Is this a fee-for-service Medicaid? Is it a managed care Medicaid? Are there any sort of limitations or exceptions that you don't know about? So it's really, really important that you do take a moment or two to check eligibility when you're taking on these new cases. So it's a two-step process. First step is the eligibility request. Very straightforward, simple, nice and easy to do for you. So you're going to start by entering in the client's Medicaid ID number or the member ID number. And in New York State Medicaid, that's always going to be 2 letters, 5 numbers, and 1 letter. That's the sort of pattern that you're going to see for all New York State Medicaid member IDs or client IDs. 2 letters, 5 numbers, 1 letter. If you don't have the member ID or the card, you do have the option of using the right-hand side, where you could put in all of the client's information, that's first name, last name, the date of birth. You will need the social security number if you're using the right-hand side here, as well as the gender. You don't have to worry about the county code. So it's either or, the left side or the right side. We do recommend, though, that you do use the left-hand side, the client ID, because you're going to need that client ID sooner than later, because that's the only way you're going to be able to submit your claims is by using the member's ID, the client's ID. All right, so 2 letters, 5 numbers, 1 letter is the member ID in New York State Medicaid. So you'll put that in there. Then you have the date of service field. Now, the date of service automatically is going to default to the current day that you're logged in, and you could leave well enough alone at that, or you can see there's a little calendar icon there. You can click on the calendar. You can also type in a date if you'd like, and you could type in a date going back up to, technically 2 years if you wanted to check a date in history. The one thing we really don't want you to do with the date of service is we don't want you to put in a future date, because we really don't know what a member's eligibility is going to look like in the future. All right, so you can either let it default for ease of use to the current date that it's going to be logged in as, or you can check a date in history. As far as the service type goes, MEVS automatically defaults to 30, health benefit plan coverage. And just let that, let it alone with the 30. That's fine. You can see on the left-hand side under service type, there's a long scrollable list of service types, and there's really no reason to do that, sort of muddy the waters. Just try to keep it as simple as possible, and that would be client ID, let it default to the current date of service, default to 30, and then click submit. Now, once you click submit, you're going to get a confirmation up on the top left that says your request has been submitted. Now, once you have your requests been submitted, back here under eligibility, we're going to go to step 2, which is the response. And you can do this right away. You don't have to submit the request and then come back, later on, an hour or two later. You can just do this immediately. There's, no time lapse that you have to worry about. So you can go straight into responses, and you'll see a screen that looks like this. Now, the top of it has search criteria, where you can say, okay, I know Mr. or Mrs. Smith were here, 6 weeks ago or a month ago. You can go back and change this to 30 days, or you can actually go back as far as 120 days. You can pick a date range. You can sort by a client's ID or a last name, but you really don't have to worry about the search criteria there, because the individual that you just ran the eligibility request for, it's going to be listed right here. In this case, we did several in a row, but the one that you just did is going to be on the top. And you're going to click on the client ID. You'll notice that these are all what we call hyperlinked. They're underlined here and they're clickable. So by clicking on the client's ID, you'll wind up here, which is going to be the eligibility response details page. So this is what you want to get to. This is where you'll find out all the nitty-gritty, so to speak, about what's going on with this member's eligibility, their benefits for Medicaid. So this first box is going to be the client's demographic information. So it starts with the client's ID. So again, the 2 letters, 5 numbers, and 1 letter. We'll give you back their gender, their date of birth, their anniversary date and recertification month with the Medicaid program, their county of fiscal responsibility, the date of service that you requested. And then on the right-hand side, you'll see things like the member's name, their address. Then there's room for an office code. Now, the office code could be left blank, just like this one, or you might see something like this, an H78. Now, if you see an H78 next to the office code field, that means this member received their Medicaid benefits through the New York Health Benefit Exchange, also referred to as the New York State of Health. Now, it's good to know where the member received their benefits, because if for some reason there's an issue or a problem with the member's benefits, you typically have to go back to where they receive their benefits. We at eMedNY, at GDIT, we can't really help you as far as member benefits goes. We can see what you see when you check eligibility and maybe a little bit more, but we can't go ahead and make any changes or corrections or do anything with a member's benefits. That's something that is either done with that H78 by the New York Health Benefit Exchange. It could also be handled by the county listed here. So we refer to this as the county of fiscal responsibility. So if there's no office code there, you might want to reach out to the county Department of Social Services. Could be a caseworker at the local county Department of Social Services that could help with member benefits as well. And then the third option that plays in here with the benefits for members and clients would be the New York City has the Human Resources Administration. The HRA, or the Human Resources Administration, they act sort of like the local county Department of Social Services throughout the rest of the state. But in the city of New York, the 5 boroughs, they have different offices of the Human Resources Administration. And those offices each have codes. So if you don't see something that's an H78, but you see a different code here in the office, that's indicating more than likely that this person's in New York City. And that's the code for the Human Resources Administration office in New York City. And in the MEVS manual, there is a list of those codes, so you'll know whether that individual received the benefits at one of the local Queens offices or Kings County or whichever the different 5 boroughs offices that the individual received their benefits. All right, so we try to give you back as much information as possible to sort of make your lives a little bit easier when it comes to better understanding members' eligibility. Now, the second box here is going to begin to tell you, well, what is the status of this member's eligibility on the date of service that I requested? I'm only going to give you a handful of examples here just to give you sort of an idea. We do, as I said, have a MEVS, Medicaid Eligibility Verification System webinar that you could sign up for, where we spend about an hour or so just going over eligibility as compared to the 10 minutes that I'm doing here as part of this ePACES session. So this is not Medicaid eligible. So if you get a response that says not MA eligible, for all intents and purposes, this individual is not covered by Medicaid. So if you were to submit a claim to us for that date of service, more than likely your claim would deny for that member or that recipient being ineligible on that date of service. That's a really good reason, like I said, to check eligibility, because you want to see if the member is actually eligible. That would be a good reason to possibly call the county Department of Social Services or the Health Benefit Exchange or the New York City Human Resources Administration, because this member is not eligible. And you might have to figure out why that's happening, and it might require a call to, like I said, the county DSS, the Human Resources Administration, or the New York Health Benefit Exchange. This is an example of Medicaid eligible, MA eligible. So this is the response you're looking for. You want to see MA eligible. That means that this member is eligible for Medicaid on the date of service that you requested. You will see a short list, and I say short because this is all we're giving you back, what's limited here. And just because it says covered services in this case, if you don't see doula here, don't worry about it. It's more than likely not going to show up on this short list. Again, we're limited to what we can give you back there. The most important part of the response is this header response of MA eligible. So if you see MA eligible, that's sort of your thumbs up, you're good to go as far as their benefits are concerned. You'll also see here on the bottom right, certain services in New York State Medicaid do have copays, but doula services do not require a copay, so you don't have to worry about copays. One more response here is eligible PCP. And in this case, the PCP stands for a prepaid capitation plan. You'll also notice there's a third box now. That eligible PCP response, that's your sort of your red flag that this individual is eligible for Medicaid, but through a Medicaid managed care plan. And you can see down now the third box says United Healthcare of New York with an address, a phone number, and a plan code. So if you see eligible PCP, that's letting you know that this member does have Medicaid coverage, but the bulk of their benefits, their scope of benefits, are handled through a managed care Medicaid plan. Again, in this example, United Healthcare. So right now, doula services, and when I say right now, we're talking about it's 2024, still in September, your services are carved out of managed care, which means they're being submitted to fee-for-service Medicaid, which we're discussing today. Come the first of the year, 2025, next year, all goes well, the managed care plans are going to be including doula benefits within their scope of benefits. So when you see eligible PCP, United Healthcare in this example, you would have to be then possibly billing that managed care plan, that Medicaid managed care plan for your doula benefits. You'd also have to be enrolling in those managed care plans. And there's additional information that you could find about managed care plans on the doula benefits site, as well as on eMedNy's website. So just be careful when you see the eligible PCP, that's going to indicate managed care Medicaid involvement. Other information we give you back when you check member eligibility includes Medicare information, as well as third-party or other insurance information. As I briefly mentioned earlier, for doula services, they're really not covered by other payers too much or Medicare. So that's not an issue that you're going to more than likely have to worry about too much. But it is something that we have to sort of emphasize to all Medicaid providers that, Medicaid is, as I briefly mentioned earlier, the payer of last resort. And whenever other insurance does show up, it is that responsibility of the provider to check that other insurance to make sure that they do not cover your services, right? That's something you really do need to be aware of just in general. As far as the Medicaid restricted recipients program, again, something else we give you back when you check eligibility that really doesn't pertain too much to doula services. This is a case where a member may have, either been caught abusing the Medicaid system or have a very complicated case, but for one reason or another, they've been restricted to receive their benefits to, let's say, in this case, a specific dental provider, a specific hospital, a specific pharmacy, and a specific physician. So in order for them to get their Medicaid benefits, they would technically have to go to the providers listed here that they've been restricted to. Again, not something that you're really going to have to worry about too much for doula services. And then lastly, we also give you back Medicaid exception codes. And we have several pages of these codes, these exception codes in the MEVS manual on eMedNy's website. And they just further give details as to different types of coverages or limitations or exceptions that certain members might have on file as part of their benefit package. If you see the exception codes show up here, you can always go back to emedny.org and look at the MEVS manual under the exception codes and just see what an 84 means or an 86. And it's quite possible that for your doula services, you'll just find that it has nothing to do with your type of billing. All right, so that's our quick overview of checking eligibility through ePACES. I'm just going to take a quick moment here to see if anything did come into Q&A regarding any of the topics I've discussed so far, the general intro and the eligibility. If you did join late, welcome. And if you did have a question, there is a Q&A feature on your Zoom toolbar. You can go to the Q&A feature. You might have to click on that little circle with the ellipses, the three dots that says more to get there. But as I did say earlier, as far as the questions go, it would probably be best if you could hold off towards the end. But I do like to check at least halfway through to see if anything is happening as far as questions. Not seeing any, so I am going to continue along here with our new claim. So far we've covered the resources that you can find on eMedNy's website. We've gone through the general functions of ePACES down the left-hand column there, how to check eligibility, some examples of responses, and now we're going to get you into how you would submit a claim, a general overview of a claim submission for a doula provider. All right, so as far as a new claim goes, you'll always start here on the top left under New Claim. And this is going to be your first screen, general information. And the first field you're going to have to fill out is the submission reason. ePACES automatically is going to default to original. And you're going to leave it at original for all of your new claims. But if you click on that little arrow there, the little blue arrow next to original, it's going to show you 4 other options: replace, void, interim, and final. You don't have to worry about interim and final. You can just forget about those. They're just used by a different type of provider. But replace and void may come into play at some point. Replace and void are used if you submitted a claim to Medicaid and that claim paid. All right, if the claim paid and you want to make an adjustment to that claim, you would use replace. So replace is synonymous with an adjustment to a paid claim. Void is if you submitted a claim to Medicaid, we paid the claim, but for some reason, maybe you never should have submitted that claim for some reason, and you just want to give that money back, that would be a void. All right, so the 3 main submission reasons you're going to use would be original, which would be for a brand new claim. You would also use original when you resubmit a claim that didn't pay. So let's say you submitted a claim to us and the claim denied or the claim rejected, and now you want to resubmit that claim with a correction. That's still considered an original claim. All right, as long as it didn't pay, it's considered an original. So a new claim or resubmitting a claim that didn't pay. Replace is adjusting of a previously paid claim, and void is just that. You're voiding out a previously paid claim. Now, if you look here, I changed the submission reason from original to replace because I wanted to show you a field that opens up if you choose replace or void. And that's the payer claim control number field. Now, like I said, if you're choosing replace or void, that's basically telling us that you have a claim that's already paid that you either want to make an adjustment to or pay or void in its entirety. In order for us to do that correctly, you have to give us the 16-digit claim number of the original paid claim. That's the payer claim control number. It's called the payer claim control number in ePACES, but if you get a paper or a PDF remittance statement, a remittance statement is basically a summary of the claims that you've submitted to us and the status of those claims and the individuals the claims were for and if they were paid or not. So on the paper or PDF remittance statement, that's called the TCN or a transaction control number. Regardless of transaction control number or payer claim control number, different names, same number. It's a 16-digit number that you're going to have to refer back to for a replacement or a void of a previously paid claim. All right, you might not be running into that immediately, but it's something that we like to point out that somewhere you might have to get a claim that's, it's paid, but you realized after the fact that it didn't pay correctly, and you might have to replace or void that claim. Back to an original claim, your first required field after you have an original claim selected there is your patient control number. Now, the patient control number is any number you'd like it to be. Could be letters and or numbers up to a maximum of 20 digits. All right, so it's capped at 20. Doesn't have to be 20. The only thing is you don't want to put any sort of special characters, hyphens, exclamation points, asterisks. It has to be letters and or numbers. So for example, a doctor's office might put in the patient's account number that they have. So whatever number makes sense to you, you can put here as your patient control number. That's going to wind up on your remittance statement. All right. So put something here. You can make it as simple or as complicated as you like, but it must be something. And ePACES tries to point you in the direction of required fields with asterisks in front of them. So in this case, it's a gentle reminder that it's a required field. The next section down is your location information. And this is the service address that you have on file when you enrolled in New York State Medicaid. So when you enrolled in New York State Medicaid, you have at least 3 addresses: a correspondence address, a pay-to address, and at least 1 service address. This location information is your service address that you have on file with New York State Medicaid. And the most important part of this field is your zip code. You must give us the zip code +4, the zip +4 of your service address. Now, if you're not quite sure of your zip +4, again, you could go and check back with your initial paperwork, your enrollment for Medicaid. You could also type in the street address into the U.S. Postal Service's website, and you can do an address lookup there to get the zip +4. Or you can even check in, your mail, incoming mail to your address. That could have your zip +4 as well. Next field down is the member's ID, the client's ID number. So as I said earlier, that's that 2 letters, 5 numbers in 1 letter. Put that in that field there, and then you click go. So the member ID, click go. And then you'll wind up at a page that looks like this. It's basically a summary page of everything you've done so far. So it's an original claim. You put in something like 123 as your patient control number. We have an address here, your service address with the zip +4. Most important, you're not going to put ones there, right? You're going to have your actual zip +4. Once you put in the client's ID on the prior screen and click go, we automatically give you back the client's name and address, as well as their date of birth and gender. So we're going to populate that for you. You're not going to have to do that. So once you did that, you will see the name and address, date of birth and gender. And just take a moment to make sure that Joan Smith is who you're billing for. Because if you're off by 1 letter or 1 number when you key in the client's ID, you might be bringing up the wrong member or the wrong client. So it's always good to just take a moment to make sure, yep, that's who I'm billing for. That's correct. And then towards the bottom, you're going to choose the type of claim. You click on the drop-down arrow here, 4 types. You're going to be choosing professional real-time. All right, that's the type of claim you're going to be submitting to New York State Medicaid. It's a professional real-time claim. Once you choose professional real-time, you click next. And now you're going to be at the second page, or we call these tabs across the top. There are 6 tabs for an entire claim. We just finished the first one. Now we're at the second one, the professional claim information tab. Now, as I said, ePACES likes to tell you what's required on a given page, and wherever you see asterisks, these are all going to be required every time you go into ePACES, starting with the place of service. Now, if you happen to know the 2-digit place of service code, you can just type it into this field. If you're not quite sure of what goes in a field and you see one of these icons, simply click on that icon and you'll see a list of codes pop up that you can use in this field. And this list stops at 31, but it actually goes way down to 99. So you're going to choose from this list the appropriate place of service code. You're then going to give us the provider's signature on file, yes or no. Typically, yes. This is referring to that certification statement that I mentioned earlier, that every provider has to have signed and notarized on an annual basis. That's your signature on file, yes. Assignment of benefits. Again, if you're not sure of the response, you would check Y or N for no. It's typically Y for yes. Release of information is typically Y for yes, that you have a signed statement allowing you to release the medical billing information for this claim, or I, you were given informed consent to release the information. Accept assignment is A for assigned. Signature source, well, who signed that release of information we just asked you about? Was it the patient or was it somebody on their behalf? Other, could it be a spouse or parent, guardian? So you would choose patient or other. Exempt from copay, well, we already mentioned there were no copays involved for doula services. So if you wanted to, you could just put yes here. And then is the patient pregnant, yes or no? So yes, patient pregnant, or no, either way, depending on what you're doing for your service. Again, these are all required fields. And this information, I'll just pause here for a second. If you're jotting down your notes, earlier back on emedney.org, I did mention we do have the self-help documents, the claim quick reference guides, and the screenshots that I'm showing you here are all in the claim quick reference guides for professional real time. So hopefully you have that in front of you and you're able to have a copy of that. If not, you can always go back, emedney.org under self-help. You have these claim quick reference guides for professional that you could see all of these screenshots as well as the definitions of these fields. Now, there's going to be a lot of empty space on some of these pages that you're going to go through, some of these sections. So we're going to, if you were actually in ePACES, you'd be scrolling past a lot of these fields, the dates fields here, not required for doula services. The related causes information really only there if there were accidents involved, like an employment or auto accidents. We're not talking about transportation billing this morning, so we're going to scroll past the transportation fields. Then as you get towards the bottom of this page, you'll see the delay reason code field. So if you recall earlier, I had mentioned that New York State Medicaid, the general policy is you have 90 days from the date of service to get your claims in for it to be considered on time. Anything over 90 days, up to 2 years, you would have to have a valid delay reason. And the state only has a very limited number of approved delay reason codes that they'll allow. This delay reason code field here is where you'd have to put in the numeric code that corresponds to the appropriate delay reason. Now, this just gives a very, very brief description next to the numeric code. But like I showed you earlier, on eMedney's website, under information, timely billing, you'll see comprehensive definitions of when you can use these codes, examples of when you can use these codes, and it'll further explain, in particular, 11. 11 just says other here. So sometimes providers think, well, when I look at these reasons, it's not really 1 through 10, and it's not 15. So I'm just going to try to put other on there and hope for the best. But that's not necessarily going to work, because 11, when you look up the definition, actually has 5 pretty specific reasons to use it. And typically, if you were to use 11, we'd ask you to drop it to paper for a practitioner or a professional claim to let us know which version of 11, 11A, B, C, D, or E are you using. And they have things to do with submitting a claim over 90 days because it's going to be adjusted or voided, interrupted maternity care, IPRO claim denial reversal. So there are specific reasons to use 11. So the short of it is I don't want you to be using 11 if you have a claim that's over 90 days, thinking that it's a generic response and you're just going to put other. It really shouldn't be done that way, and it does have specific uses. And if you have questions regarding the use of these codes, then you could check on eMedney's website under information, timely billing, and you could look at that documentation on timely billing. If you could get your claims in within 90 days, it's a moot point. You don't have to worry about it. So hopefully, as you're doing your billing, you'll be able to get your claims in within 90 days, and you won't have to even worry about the use of these codes. That's the bottom line. Then you get to the very bottom of this page. You can skip the rest, click Next. And now we're going to be at the third tab. So we just got through the first 2 tabs. Now we're on the third one, which is the provider information. And for doula services, you really don't have to worry about the 4 provider types listed here. You'd be able to leave them blank. You are the rendering provider. You can only bill for your own services. So you don't have to put yourself here. You've logged in under your name and your NPI. So you are billing for yourself. So you don't have to worry about putting in that rendering to say, hey, it's still me. So you don't have to worry about doing that. You can leave that blank. You don't really need a referral. You don't need the referring provider listed here. You don't have to give us the primary care or a supervising provider. So you're just going to go to the bottom of that section and click Next, which then brings you to the Diagnosis tab. Now, all professional claims, and doula claims, like I said earlier, are considered professional claims, require at least one primary diagnosis code, ICD-10 diagnosis code. Now, ePACES automatically defaults to an ICD-10, which is the coding structure for diagnosis codes. It's been that for several years now. Here's where you're going to give us your diagnosis code. Now, there's room for up to 12 of them for most providers, but for doula services, you actually have very specific guidance on diagnosis codes. So your diagnosis code is going to either be Z322 if you're billing for prenatal support, or Z322 if you're actually doing the support during delivery and labor. Z323 is for postpartum support. So these are the specific diagnosis codes that you're going to be putting on your claim. And it's important that you use these codes because they play into how we process your claim, in particular when it comes to that other, insurance or third-party information. So again, Z322, prenatal support, as well as supporting labor and delivery, and Z323 for postpartum support. The key here is if you're familiar with diagnosis codes, there's usually a decimal point in a diagnosis code. You'll note here there are no decimal points, and that's correct. That's not by mistake. That's correct. We don't want you to put decimal points in diagnosis codes in ePACES, right? So this is in your policy section. It's in your guidelines on eMedNY's website. It's mentioned as well on the state's website for doulas benefit services. So please take note. This is one of those crucial things, diagnosis codes for doula services. And that'll go in your diagnosis 1. You'll then click next. That brings us to the other payer section. Since, as we said, the vast majority of other insurance companies, other payers do not cover doula services, you'll be able to, for now, skip this. If there's a rare case where another payer does cover doula services, or there might be insurance on file like Medicare. If for some reason Medicare shows up, Medicare Part B, you might have to fill out this other payer section by doing what we call a zero fill, where you basically say that there is other insurance on file, but they do not cover it. If that situation happens, you might want to reach out to our eMedNY call center, and we can further explain to you how to enter information on the other payer section here. But since the vast majority of doula services are not reimbursed by other insurance companies, we're going to be skipping the other payer section for now. All right. But again, if you have that rare case that other insurance does show up, in particular, let's say a Medicare plan, then you might have to reach out to eMedNY's call center at the 800-343-9000 number, and they'll be more than happy to explain what has to occur on the other payer section. You'll click next, and now we'll be at the last section here, which is the service line. Now we're going to give you here an example of what a doula service line would look like. All right, so this is not exactly what you're going to do. It's going to depend on what you're doing. Is it going to be a prenatal or postpartum? Or is it going to be labor and delivery? So this is just an example of what a service line would look like. So the first column here is the line item control number. We're not looking for anything in that column, so you can leave that blank. So your first required information is going to be the date of service, which you're going to put in the from field. You don't have to put a from and to. You can leave the to field blank. So the date of service is going to go in the from box. You can either type it in, or you can choose the calendar pop-up to put that date here. Next field over is going to be your procedure code and modifier fields. That's what PROC and MOD stand for. It's procedure code. Now, again, for doula services, you have very specific procedure codes. Here they are. So we have T1032. That's going to be your prenatal or postpartum support. Or you have T1033, and that's your support during labor and delivery. So you're going to be putting in the appropriate code as your procedure code in that top box. The little boxes underneath it, the 4 little boxes, those are for modifiers. And there's a situation for telehealth where you might need to put in a modifier. And we're going to refer you to the state's telehealth guidelines for the use of a modifier possibly here, or the telehealth place of service codes earlier on in the claim. All right, so at minimum here, you're going to have to give us one of those T codes, T1032 or 33, And then you'll have to see if there's anything having to do with telehealth. You can always follow the guidance listed here by going to that website, the State Department of Health, and follow the guidelines for telehealth if any modifiers should be added to your claim as well. Next column over is your charged amount. Now, depending on which of those T codes you're billing for, there are specific fees involved. And again, you can find these fees, the fee schedule, as part of your provider manual on emedney.org on the Doula Provider Manual. So the T1032 for prenatal postpartum, New York City's fee currently is $93.75. For the rest of the state, it's $84.37 when you're billing for the T1032. And for labor and delivery support, the T1033, New York City's fee is $750, and the rest of the state is $675. All right, so you're going to put in the appropriate charged amount in the charged amount field here. Service count, and that's going to be the number one. You're billing for one service count, one unit for whatever it is that you're billing for, be it the prenatal, postpartum, or the delivery. The diagnosis pointer is going to be 1. That's basically telling us you gave us the 1 diagnosis code of that Z code back on the diagnosis section over here, right? We talked about the diagnosis, so you could put a 1 there. Emergency related, typically that would be a no. Once you've entered in your date of service, your procedure code and possible modifier, the charged amount, your service count, and your diagnosis pointer, you're then going to click Finish at the bottom. Now, when you click Finish at the bottom, you're not quite done yet. There's one more crucial step. You'll see a screen that says Claim Entered, Complete, and then you'll see these buttons down here at the bottom. Once you finish keying in your claim to ePACES, you must click Submit Real-Time Claim. If you walk away after clicking Finish and you don't click Submit Real-Time Claim on the next page, we don't know about your claim and it'll never be processed. Sort of like picture filling out a paper claim form, filling out all those fields on a paper claim form, signing it, putting it in an envelope, and just never mailing it. You did all that work to create the claim, but it was never sent, or in this case, electronically submitted to Medicaid for processing. All right, so don't forget, after you click Finish, you must click Submit Real-Time Claim on the very next page, which is going to look like this. Once you click Submit Real-Time Claim, you're going to get another screen, looks similar. This time it says Sent, and then there's a message, your claim was successfully submitted, and now we want you to check the status of the claim, excuse me, the real-time status response on the left-hand side. So you're going to check that status of the claim by going to Real-Time Responses on the left-hand side here. All right, so it's sort of just a little message to say, okay, we received your claim. Now we want you to go to Real-Time Responses to check that claim status. Now you don't have to wait too long. You don't have to, come back later or tomorrow. You can wait a couple of seconds. Once you've clicked Submit Real-Time, go to Real-Time Responses, and you'll see a screen that looks like this. Now, the top part of it is search criteria. Similar to when we checked member eligibility earlier, there was a search criteria page where you could check, X number of days back, or you could check based on somebody's client ID or name. But you don't really have to worry too much about that because the eligibility, excuse me, in this case, the claim, I'm talking about eligibility, which we did a little while ago. Now we're on the claim. When you're checking the claim status, you're just going to click on the individual's name over here. So this little bit of information gives you some info, but you're really going to want to click on the member's name to drill down and find out the exact status of the claim that you just submitted. All right, so we're going to click on the member's name and find out what happened to that claim that we just submitted. I'm going to give you 3 examples, starting with a paid claim. So in this example here, we clicked on the member's ID. This is their ID. Claim level status F1, finalized payment. The claim has been adjudicated and is awaiting payment cycle. We're going to show you the 16-digit payer claim control number. So that's the claim number. You charged $84.37. We paid $84.37. There's your date of service and the date we checked the status. We're then going to further break it down to each claim line. So there was only one claim line in the example we showed you. So again, it paid. There's your date of service. We billed for the T1032, charged $84.37, paid $84.37. So this is good. This is what you want to see. So this is an example of a paid claim. Next page, we have an example of a denied claim. So instead of an F1 finalized payment, this one is saying F2 finalized denial. The claim/line has been denied, and then it says the claim total denied charged amount. We'll still give you a payer claim control number, the 16-digit claim number, but you'll notice here you charged us $84.37, but we didn't pay because the claim denied. And if we go down a little further to the claim line, same thing. You billed for the T1032 and it denied. And if we make that a little bigger, you'll see that it denied, and it says something about an entity not eligible for benefits, the patient. So if you get a denied claim, there are a couple of things you could do. One, sometimes the information we give you back here is sufficient enough for you to figure out what went wrong with the claim. If it's not, you can possibly call the eMedNI help desk at the 800-343-9000 number, give them your NPI, your provider ID number, tell them you entered a claim and it denied. You can give them this payer claim control number. If you give them that 16-digit claim number, they can look this claim up for you and then say, oh, okay, well, you did X, Y, Z, and this is what you need to do to correct it. And then you can go back in, edit the claim, and then resubmit that claim. Or if you're like me, and sometimes you just like to do a little detective work on your own, when you get the response back, you'll notice in parentheses, there are certain codes. So in this case, there's an 88 and a QC. They actually mean something a little bit more than the little bit of a sometimes cryptic information we give you back here. So remember the 88 and remember the QC. Let's go back to eMedNI's website, emedni.org, where we started today's presentation. If you go to the eMedNI HIPAA support tab and hover over it, this drop-down list is going to show up. And the very last option on this list is something called the Edit Error Knowledge Base Search Tool, called EEKB for short. If you go to the EEKB, the Edit Error Knowledge Base Search Tool, you can search why your claims have denied or if they've even pended. And there's 3 different ways you could search. You could search the first way based upon the 5-digit eMedNI edit number that we give you back if you get a paper or a PDF remittance statement. If you get an electronic remittance statement, you would put those codes under the option 2 as a HIPAA code on the left-hand side. ePACES codes, they go on the right-hand side of option 2. So again, what did we have? We had 88 in parentheses, and we had QC. The third option here, by the way, is if you wanted to type in a keyword, you can search by specific text as well. But since we're using ePACES, we give you back the codes here, the healthcare claim status codes and the entity identifier code. Enter those codes, click go, and you'll wind up here with a detailed explanation of what an 88 QC actually means. So it's equivalent to edit 162, which is the recipient is ineligible on the date of service. So we just told you that your claim denied because the member or the recipient is not eligible on the date you billed for. We'll give you the cause, spell it out for you, what you need to do, and the possible solution. And this is the example I gave you earlier when we checked eligibility and it came up no cover, it came up not covered, not MA eligible. I had mentioned reaching out to the local county Department of Social Services of the patient, or the Human Resources Administration in New York City, or to the Health Benefit Exchange. All right, so this is a perfect example of a possible denied claim and what it means. So that's an excellent resource for you, the Edit Error Knowledge Base, to look up why your claim possibly denied. The last example here is a rejected claim. A7, acknowledgement rejected for invalid information, 255, diagnosis code. Now, in this case, your claim rejected. It didn't pay, similar to a claim that denied, but the big difference is, as it says there on the bottom, are rejected claims not going to show up on your remittance statement. So if your claim pays, if your claim denies, if your claim pens, it's going to show up on a remittance statement. A rejected claim will not show up on a remittance statement. So this is your one chance to see if your claim rejected. That's why it's so important to check the status of your claims after you submit them. Because if you don't catch a rejected claim here, you're not going to be notified of that rejection on a subsequent remittance statement that you're going to get. So it really is a crucial step to check eligibility after you submit your check the status of your claims after you submit your claims. Now, in this case, the rejected claim is for A7 255. Now, it's pretty obvious because it says it's a diagnosis code. So in this case, your claim rejected because of the diagnosis code. Maybe you didn't put in the proper Z code that was listed that we talked about earlier. So you'd have to, in this case, go back in, edit your claim, resubmit it with a corrected diagnosis code. Now, if you weren't quite sure of why your claim rejected, sort of like you weren't sure if the claim denied, there's a document to help you with rejected claims. Back on eMedNY's website, same place under eMedNY HIPAA support, you go to crosswalks this time. Denied claims, we went to the Edit Error Knowledge Base here. Rejected claims, we go to crosswalks. Now, under crosswalks is a document that's called the Pre-Adjudication Crosswalk for Healthcare Claims. So these rejected claims, they're called pre-adjudication rejections because they're not even entering our Medicaid claim processing system. They're sort of being stopped right at the front door and saying, where do you think you're going? You know, there's something wrong with your claim that we're not even going to let it into the claims processing system to process it. So the example that we gave you of an invalid diagnosis code, A7 255, shows up right here as one of the reasons for a rejection. ICD-10 diagnosis or other diagnosis is invalid or not payable according to New York State Department of Health policy. So by looking at this document, you've basically confirmed what we already figured out, that you have a diagnosis code issue, and you'd have to go ahead and correct that diagnosis code on your claim, resubmit it, and then hopefully your claim will pay. So this is just another helpful document that in this case will help you with clarifying why a claim rejected. So getting to the end here, wrapping things up, we have reference and contact information, of course, eMedNY's website at emedny.org. That's where you'll find your doula provider manual, as well as other helpful documents, including the ePACES manual, the ePACES Claim Quick Reference Guides. You also have the Doula Services website, the State Department of Health's Doula Services website, and eMedNY's call center, the 800-343-9000 number, if you have any additional questions regarding what we discussed today, or if you have a specific concern about a claim that you've submitted, the status of that claim, you can always contact the eMedNY call center for additional assistance and training. All righty, so I am going to pause here. That's pretty much the walkthrough for today's ePACES for Doula session. I'm going to go ahead and check for questions. I'm also going to look at questions and release a quick survey. We like to release a brief survey or a poll at the end of our training sessions to get a little bit of feedback. So I'm going to release that poll, and this will also be the time if you wanted to, where you can go ahead and type your questions into the Q&A. So I'm going to look at those questions and release the poll for you at the same time. So if you have a chance, you should see a poll show up on your screen. We'll ask if you could just take a moment to give us a little bit of feedback. We do appreciate that. And at the same time, I'm going to take a look at the questions that you have that came in. So bear with me a second or two, and we'll take a look at your questions. Okay, a couple of questions here. Thank you for those who are filling out the poll. Appreciate your feedback. So I'm going to look at some of these questions. We'll go through some of the questions here and see what I can do to answer them for you. So the question is, the patient control number is a number that we make up. Yes, so you make up the patient control number. As I said, it's pretty much anything that you'd like it to be, as long as you stick to using letters and or numbers, and the field has a maximum capacity of 20 characters. All right, so you want to make sure it's 20 or less, and it has to be composed of letters and or numbers. But that is something you make up. That's absolutely correct. There's another question about how does the Medicaid restricted recipient program affect doulas, new providing doulas? As I said, the restricted recipient program should not directly impact doulas and your enrollment or your providing of your services as doulas. That's not something that you should really have to worry about too much as far as doulas go. That really affects other types of providers. The state has the ability to restrict members to get their benefits from specific providers. But as I said, doula services should not be directly impacted by the restricted recipient program. As far as the service counts go, there's a question about doing one for this service unit or two. You're basically billing one. Let's say if you're doing a prenatal, that would be one unit. If you're doing when you're billing for postpartum, that would be one unit. If when you do your delivery, that would be one unit. So you're not really increasing the number of units at any given time. You're billing one unit for each of those services that you're rendering. So you're not necessarily billing for a quantity of more than one at a time necessarily. There's a question about, looks like managed care and enrolling in managed care plans. Now, currently, currently managed care is not reimbursing, the managed care Medicaids are not reimbursing for doula services. But if all goes to plan, come January 1st of next year, 2025, doula services will be considered within the scope of benefits of the Medicaid managed care plans. So at that point, you would have to be participating in those plans as well as billing the Medicaid managed care plans for the doula services. But currently, you will be billing for Medicaid fee-for-service and not the managed care plans, just like I said, through the end of the year, it's still being covered by Medicaid fee-for-service, which again, what we're discussing today, in which you'd possibly be using ePACES to bill. But come the first of the year, 2025, that's when the managed care Medicaid kicks in. See if there are any other questions that are here. Thank you for those so far. Appreciate that. Okay, follow-up question to the managed care. So does the managed care plans, once they come into play, are they using the same websites for submitting the claims? No, the ePACES is going to be used for submitting the fee-for-service claims that we're doing currently, or if a member still has fee-for-service Medicaid after the first of the year. The managed care Medicaid plans, they're going to have their own way of submitting claims to them. So you're going to have to follow the guidance and the guidelines by the different managed care plans. But the training that we just did today for ePACES is for Medicaid fee-for-service claims, not for the managed care Medicaid claims. All right, there's a question about submitting for multiple dates of service on the same claim. So yes, if you have multiple dates of service, let's say you're doing several postpartum visits on different dates of service, and you're using ePACES, you could certainly submit those all on one claim. You would just have different claim lines for each of those dates of service. So you'd have the claim lines for all the different dates of service, and you'd complete each claim line for the proper T code, whatever code you're billing for, and then the proper information, the dollar amounts. But correct, you can have one claim with multiple lines on it. That's fine. You can definitely do that in ePACES. Have different dates of service on the same claim. That you could do that. That's fine. There's a question, do you have to check for every date in the service month for billing? So I guess maybe we're going back to checking member eligibility. It doesn't hurt to check member eligibility regularly. A member's eligibility can change, and it can certainly change from month to month. So if you're providing services, which you more than likely would be going from prenatal through delivery and postpartum, I mean, you could possibly check eligibility. It's up to you. It doesn't certainly hurt to check eligibility to see if a member's benefits have changed over a period of time. Bottom line is that you do check eligibility, at least initially, to know the member's status for eligibility on the dates of service that you're rendering. But it's always a good practice. We do recommend that you do check eligibility. All right, I'm sit here another moment or two. Thank you for all those questions. Appreciate that. Thank you very much. See if any other questions come in here. I'll wait another few more minutes. I'm also going to see if if we have any questions here. No, we're good with that. Samantha, I'm going to see if I can unmute Samantha from the State Department of Health, see if Samantha has anything additional that you'd like to add.
Hi.
Hi.
Thank.
Sure.
Hi. Um, nothing, nothing specific to add about the presentation, but just for the person who is asking about contracting with Medicaid managed care programs, um, echoing what Neil was saying, and I can drop the link in the chat to the Doula Services website where we have listed um, points of contact for each Medicaid managed care plan. We also have a link to the enrollment reports that are updated monthly for the Medicaid managed care plans. So you can see which plans are operating in the counties that you serve. Because sometimes people look at, the 14 different plans, the 14 different Medicaid managed care plans, and are wondering or have asked, do we need to contract with all of them, with all of the plans? And the answer is no. You can contract with as many or as few plans as you'd like. A good place to start would be to see which plans are operating in the counties that you serve, and then choosing from there which makes the most sense for you to contract with. So, Neil, at the moment, it's only letting me send a message to you. So I just sent the Doula Services website to you. And then if you want to put it in the chat for everyone, you can go, there's a Medicaid managed care section in the table of contents, and it'll bring you down. You can see the points of contact list. So it's up to each individual doula to reach out to the Medicaid managed care plans directly, and inquire about their enrollment process.
Excellent. Perfect. And I just did send that to everybody. So everybody should have that link to the Doula Services website. Thank you very much, Samantha. Appreciate that. Thank you. I don't see any other questions coming up here. I'll give it another moment or two. But I thank everybody for attending today. Hopefully we're able to answer some questions for you about doula and doula services and doula billing. We are going to have another one of these ePACES billing sessions. The end of, I think we'd have the monthly for the next quarter. I believe the next one, we're still working on next quarter, is October 30th. But you'll be able to check back on eMedNY's website on the training calendar. But I do believe October 30th is when we're scheduled to do another one of these. So if you wanted to attend another, or if there are other individuals, other doulas that were not able to make today's session that could possibly make the next one, we are going to be offering these, like I said, monthly, October, November, December. The next one should be on October 30th. All right, let me see if any other questions coming up. I don't see any other questions here. There was one other, again, I guess the question was reiterated. Yes, okay, I got clarification. It is October 30th. Thank you, Jessica. Appreciate that. We have a lot going on, so sometimes it's hard to keep track of what's on, what seminars on what webinars are on which days. There's another question again. It looks like another one about the patient control number. Yes, it's a unique number that you create. You could be as creative as you'd like on the patient control number. You don't really have to overthink it. I know sometimes we get calls, and even the eMedNY help desk get calls about the what do I put in the patient control number field. You can make it unique to each client. So if you have multiple clients going on at the same time, you could certainly do that. You can put, some providers will put a client's ID number in there. They'll put a date of service in there. You could put whatever sort of makes sense to you. It could be unique to the client if you're juggling several at the same time and you have several going on. If you only have one client, you could make it whatever you'd like. Client's initials, a date of service, member ID number. It's going to show up on your remittance statement, that number. So again, you don't really have to overthink that field as far as us editing it. You just really need something in there that makes sense to you. Like I said, if it was a doctor's office and you were the patient in the doctor's office, the doctors would typically have a patient's chart number or a patient's account number. Or if it's a transportation provider, they might be giving a ride number for the rides that they're giving out. So you can really make it whatever you'd like. Okay. I don't want you to sort of overthink the use of that field. It is required, absolutely, but you could put whatever you'd like there. Just again, saying the limitation would be a maximum of 20 characters, and whatever it is you are putting there has to be letters and or numbers or a combination of both. Thank you for that question. Okay, I think I don't see any new ones coming through here. So I think we might be good to go. I thank you all very, very much for attending today's session. Thank you to my colleagues in the background hanging in there as well from eMedNY and from the State Department of Health. Thank you for attending today as well. And hope you all have a very good afternoon. Take care now.